Hi, I'm Dr. Priyanka, gynecologist and women's health expert. So, in continuation of our talks on breast cancer awareness, today let's learn more about mammogram. Mammogram is a test, it's an investigation. We suggest women to start their annual every year mammograms from the age of 40 or even earlier if they have a higher risk of breast cancer, say a family history of breast cancer. That is when we will suggest that the mammogram is done even from the age of 30 or 35. So mammogram is basically a film or an x-ray or a picture which is taken with a special safe x-ray machine so that the dose of radiation is minimal. There is fear and worry about mammogram being very painful, and that is why women hesitate to do the mammogram. Mammogram can be uncomfortable, but it is not painful. What happens during a mammogram is that you are going into a room where there is a female technician or a female nurse who is going to help you get the mammogram done. So the woman has to go into this room, and there is this mammogram machine. You go close to the machine, and the breast, one by one, the mammogram is done. So one breast is going to be placed on a flat surface, which is called the cassette holder, and then another flat surface is going to compress the breast so that clear film is being taken. The compression is important so that, number one, there is minimal movement, and also we get a very clear image or a clear picture. The compression is around for say 10 to 15 seconds, and that is what causes discomfort sometimes, but it is not painful. Once the mammogram, one film is taken from one angle and then you have another angle taken, then it is repeated on the other side. So this way both the breasts we're able to see very clearly. Nowadays we have 3D mammograms, digital mammogram, by which very clear image is obtained, and your report is usually ready in 24 hours, which is read by the radiologist. So mammograms are good tools to detect any kind of problem or cancer, even at a stage 0, a non-invasive stage, whereby the 5-year survival is better, and we are able to diagnose a problem even before you know that the problem is there. So breast cancer, when it becomes a stage 2 or a stage 3, we will talk about the stages in another video. By that time the cancer has either spread from one breast to the other or to other parts of the body. So do understand that mammogram is an important tool. It is freely available if you are more than 35 or 40, and if you have a risk of the breast cancer then even earlier, start doing your mammograms at least by the age of 40 and stay ahead in this path by which we are taking care of our health and also taking care of our family's health. So do take care.